Hi, I'm Gary White for Channel 6 Central Kentucky Television at the Marion County Economic Development's office, First Friday Forum. And this month, the discussion was about sepsis, and I'm here with Daryl Rakes, who is going to tell us, is a sepsis survivor and has a website with that area, and also with Dr. Ashley Montgomery, who is his doctor who took care of him while he was in the hospital in UK with sepsis. But first of all, let's make people aware, what is sepsis?
Sepsis is just an overwhelming infection to your body. It's not if you get a cut or if you're in for a minor surgery, it actually gets into your bloodstream and it travels throughout your body. And then it causes your blood vessels to become leaky, which means less oxygen to the rest of the parts of the body, and which leads to organ failure and sometimes death.
And for you, this occurred just under 2 years ago, and for you, you had results going on internal organs, is that right?
Yes, it occurred in 2015 in May, and I was in the hospital for 58 days. I had my kidney was affected by it, my lung was affected by it, I had a collapsed lung, my lungs were bleeding due to the knee surgery. They had to quit giving me blood thinner, so they had to put a filter in me, and then I got my legs full of DVTs or blood clots.
Okay. So you were Mr. Rake's doctor for all that period of time.
Correct.
How common is sepsis?
Sepsis is very common. It's actually one of the most common killers in the United States, but often under-recognized. It kills more people than cancer and HIV and most other things that you've probably heard of combined.
So is it as severe as what Mr. Rakes is talking about, that common, or is it just it varies the levels?
The levels do vary some. So the severity that Daryl had was obviously very severe. And what he had would be the sort of final stage of sepsis, what we refer to as septic shock, where he had many organs damaged by the lack of blood flow and the lack of oxygen. Sepsis can kind of be caught upstream a little bit from there, and that would be the actual definition of sepsis before you have sort of widespread organ damage.
And we were talking with the discussion that it's your body doing what it should be doing, it's just kind of exaggerated, correct?
Correct. So sepsis is the normal physiologic response to an infectious source. It is the leakiness that occurs in blood vessels when you hit your elbow or when you have a cut. The way that the blood vessels allow the cells to get out of the blood to the areas that are damaged is they become leaky. In sepsis, for some reason, the body has an overwhelming response, and every blood vessel in the body becomes leaky at the same time. So the infection may be in your arm, or in Daryl's case in his lungs, but the blood vessels in his brain, the blood vessels in his kidneys, in his leg, in his chest all became leaky, and they didn't need to do that. That then causes the flow of blood within the vessel to come down. Think of a garden hose with a trickle of blood, and it gets bigger, the blood just drips out the end. The blood carries the oxygen, which then causes the organs and things to become damaged.
And is it known what causes people to get sepsis?
So we don't understand all of the triggers, who will and who won't get sepsis. We know that people that have a lot of chronic conditions or people who have any sort of suppression of their immune system, the elderly and small children are more likely, but obviously Mr. Rakes fits into none of those categories, and he got florid sepsis. So it's the normal response sort of overreacting.
And now you are on a campaign to bring sepsis awareness to people, and
Yes.
that's why you're here as well with the forum.
Yes, actually my wife's a teacher, and so it was voted on by the FCCLA group across the state of Kentucky to raise $25,000 this year for sepsis as a goal. And so what I've been doing is traveling around to different schools, giving presentations on sepsis and trying to bring awareness.
And you also have a website that you created for
Yes.
individuals who suffer.
I have a website, and it's www.easy-caregiver.com. It tells about my story, but it also has a couple pages in there with also a mobile app that you can put on your phone that allows you to communicate when you cannot speak.
Daryl is very humble. When he was in the ICU, he was very frustrated by the fact that he couldn't push the nurse call button. And so one of the things that he did when he got out of the hospital was he spent some time in recovery. And during that time, he decided to design an interface between an iPad and the nurse call system in the hospital to allow patients to have easier access to communicate with their caregivers and the nursing staff and physicians when they're critically ill. It's a pretty incredible thing that he has done. So.
Thank you.
And we do want to mention that prior to this, you did work for one of the factories here in Lebanon as an engineer, traveling around, which this disease has caused that not to be a ability now, right?
Yes, I was an engineer for Alutram and traveled all over the world to decorate the interior of the vehicles. I helped design and help put it into production. And due to my illness, I no longer can do that, and actually on disability.
So what are the results of the sepsis? What are you living with as a result of having that sepsis now?
Well, I have PICS, which we discussed in the presentation. I have PTSD. I have high anxiety. I have muscle weakness. I have neuropathy. I have cognitive issues, as well as some memory issues. So there's probably a dozen different things that it's affecting me, and you just learn to manage them.
And the results of ongoing results from sepsis can be different depending on the patient, is that correct?
Correct. I mean, there are some patients that can have sepsis and go back and lead a fairly normal life. There are some that never ever go home and are with their families again. And that sort of span or that continuum has a lot of factors. Some of it is how healthy you were before, your age, those things we talked about. Some of it is how severely ill you were. Obviously, Daryl was on the more severe end of that spectrum with multi-organ as affected during his hospitalization. But some people can have issues with only physical limitations or only cognitive or only psychosocial. Some people have limitations in all of them after, and we always talk to patients after ICU stay about PICS, which is post-intensive care syndrome, or sort of the scope of changes that occur to a person after they experience a critical illness.
And you've been doing a lot of research and programming with that. Is that correct? So you're talking about
Correct. I run the ICU aftercare service at the University of Kentucky. And so part of what I'm focused on is helping patients, families, and rural Kentucky physicians to understand what it means to be a patient who survived an ICU or a critical illness, and what they can expect for life and how to help sort of navigate those changes that have occurred within their body.
And you did have another young lady here who had suffered with sepsis, and hers was actually where the tips of her fingertips were affected?
Yes, it was, her tips of her fingers were gone, and I think she was in ICU for a week, and then in just a regular room for the other week.
And she had the flu.
Yeah, and she just got it from the
we
flu.
knew what caused her sepsis, but the flu, we don't have a lot of great medicines to treat the flu, and so for some reason she got the flu. She's a healthy young teenager and had overwhelming sepsis from it and actually lost the tips of her fingers.
So today was an opportunity for awareness of sepsis, and Mr. Rakes here has a pin as well that you want to tell us about. That is your awareness pin.
Yes, as the pin, everyone knows what pink stands for, and it's breast cancer, but a lot of people don't know the colors for sepsis, and those colors are red and black. So yes, I wear a red and black pin for sepsis.
And we do want to mention too, you had your buddy Harvey here as well that goes around with you, right?
Yes, I have my little dog Harvey, and he's an emotional support dog. When my anxiety gets really high or I need a quiet space to go, yes, he will sit in my lap, and he's a support dog.
And he and your wife are back there now. I think he's looking for you, so
yeah,
I'll let you go.
Probably, yes.
And again, this was at the Marion County Economic Development Office's First Friday Forum. I'm here with Dr. Montgomery with the University of Kentucky and with Daryl Rakes. It's been Gary White with Channel 6 Television.